Hi, everybody. Dr. Nikita Vizniak here, and I am going to walk you through a fantastic injury. I've put these pictures up on my Instagram account at Dr. Nikita Vizniak, and we can talk about it in detail. Couple of key things to get. This is a significant inversion ankle sprain that happened to me 1 year ago. And I've been meaning to do this video forever. Finally, I've got a little bit of time where I can do it here on a holiday long weekend. So hopefully you'll learn a little bit from me as we go through this. So this is going to be following evidence-informed best practices here. So if you look at this ankle, this is day 2 after the injury was done. I am at my clinic and you can see a beautiful, beautiful bruising along the outside edge of my left ankle here and all the way up to my gastroc and soleus. The bruising is about that high. And just so we can do a bilateral comparison, if you look on the contralateral side, you can see good arch height. You can see my medial malleolus. You can see the tendons are pretty obvious. And here we are looking at a big, hot, swollen balloon of an ankle right here. Now, I want to say it was Brazilian Jiu-Jitsu. The guy was like 6'8", 385 pounds, heel hook, away we went. Nope. I am playing recreational badminton, which I play 4 times a week, except that the people that I have to play against are from mainland China, Taiwan, Malaysia, and have been playing since they were children, and they're all senior citizens, and they're all kicking my ass here. Regardless, it's a lot of fun, except what I decided to do on this day, or the day before this injury actually happened, pardon me, was jump smash. So I get up, jump smash, crack, win the point, and I decided to land in a severely inverted position with all of my body weight coming down. At the time this was done, I weighed about 170 pounds, and I heard a crack at the time of injury. My lateral malleolus hit the ground. I could hear it actually hit the side, the snap. I dropped to the ground immediately, and I felt absolutely nauseous following this. Obviously, I didn't play for that day and had to hobble off and kind of just test and see what my ankle could do before it puffed up and swelled up. Regardless, bad injury. Yeah, because you even remember my fibularis longus and brevis tendons kind of snapping out just a little bit and then snapping back in. Like I felt absolutely sick after this was done. So you can see a good parasympathetic reaction taking place with this injury as well, telling you it's probably a little bit more severe. That night, I couldn't even sleep. This happened at 10 in the morning. I had to go treat that day. That evening, I had to go to the hospital to get x-rays done. This is Dr. Jeff doing those x-rays. Shout out to Dr. Jeff Martineau, doing some evaluation in the hospital there. And he also works in our clinic 2 days a week in New Westminster. Regardless, we go and get x-rays done. I'm hobbling in. Things are not going well for me. X-rays are taken. You can see on this image, good joint spaces, good cortical margins, no disruption of cortical margins. You can see a small avulsion fracture right here where a little bit of bone has been taken away from the lateral side of the talus, but it's not anything through the joints themselves. Now I look at it a little more closely, there might be something else there, but not confirmed. Regardless, it's a relatively stable fracture right there, okay? So even the test done by the ER doc, I was pretty impressed after I waited for 9 hours to be seen by an ER doc, about 3 in the morning or something like that by the time I got there. Regardless, she did some nice inversion, eversion, talar tilts, just some Kliger rotational stress tests to see what was going on there. Definitely painful, but no significant disruption where the ankle just felt really loose, like it was totally unstable. So good findings, which means you can load it a little bit sooner, which is exactly what I did. So here I am on day 2 teaching a class the next day, and I let every student in the class palpate this ankle. Now, like most practitioners, the vast majority of students were scared of this. They didn't want to put their hands on it. It was so swollen, so hot. But actually, it is of huge benefit for you to do palpation of these things. And especially if you're a practitioner watching this video, don't be scared of these things. Work within the person's tolerance, follow your evidence-based best practices, and you can treat with massage therapy, range of motion exercises, instrument-assisted techniques, contrast hot, cold, all of that, even in acute stages. And the results for this will speak for themselves. So as we progress through, make sure I click the right thing here. Actually, I should make one other comment. Also teach quite often with Dr. Steph Gill right there as well. So fantastic stuff. Nutrition is foundational. We are trying to support the healing process of the body here. So a couple of key things. Number one, I did try to wrap it. I couldn't wrap it for more than an hour. It just felt too hot, too puffy. I had let the body do its natural thing to heal that spot. Support the natural inflammatory processes. Don't try and knock them down, support them. And one of the ways you can do that is with adequate nutrition. My good friend and neighbor Tony G is catches wild salmon. He brought me a bunch of it, and I was eating this salmon on a daily basis. I ate it like 3 times a day, actually. What am I saying? It was fantastic. And I ate everything. Good for calcium, good for protein, good for omega-3s, good for everything that you need to heal this damaged tissue. The other thing that I was doing was, and my kids were making fun of me, just gentle plantar flexion and dorsiflexion of my ankle. I'm just standing doing little steps back and forth, even in the acute stage, even that the day of the injury and the day after that injury, making sure that I can start to load that tissue to develop the strength and force that I need to be moving in the correct directions. If we scroll ahead a little bit more, this is part of my ankle rehab. Now you're looking at this and saying, Dr. Nick, what the hell is this? This is a yoga flow. Yeah, this is exactly what it is. And I'm moving my ankle weight bearing, relatively weight bearing. I do shift to the side a little bit because I can't take full weight. I come up to the front of the camera and show you how puffy the ankle still is. But as part of your rehab, you can't just focus on movements of that one injured body part. Make them global systemic movements so your brain doesn't develop neural pathways that only go to the ankle for rehab, to the ankle for rehab, and reinforce the pain pathways that you might actually have. If I can move my whole body and kind of ignore the ankle a little bit, I'm going to see better outcomes. This is a trick that I use with every single patient. Any kind of injury or rehab, yes, we'll focus on the area, but then we're going to make them global systemic movements for better outcomes. If we progress to the next thing, we can see what happens here, day 2 versus day 6. Now, this injury occurred in March, and in May, I had to go out to Winnipeg to visit some family. And while I'm there, I usually see professional sports teams, so I had to do some seminars for the Winnipeg Jets and Winnipeg Blue Bombers, so NHL, NFL, or sorry, CFL. And regardless, I thought I was going to have this best new protocol that I'm going to give to everybody that's going to work great for all of their athletic therapy, physical therapy, massage therapy staff. They are already doing what I did for their multi-million-dollar athletes. If it's good enough for multi-million-dollar athletes, it's good enough for you. And I'm no spring chicken. I'm not 20 years old. I'm coming in at like 48 years old when this injury happened. And you're going to see that I get back to actual play within 7 days. Now, is it high-end play? No. But is it functional, fun range of motion for me? Absolutely it is. So a couple of key things to get, though, is you can see the way the bruising has changed. The swelling is already way down and functional capacity is returning. And this is just so we're clear. Let me go back. Sorry. Just so we're clear on this, this is day 6 after a syndesmotic. So that's a high inversion ankle sprain with an avulsion fracture in there as well. Okay. Now, again, talk to your healthcare professionals. Make sure you're following the best appropriate rehab that you can for yourself, but you can push these things a lot sooner. Here I am on day 6. I had to do a seminar that weekend, and I'm showing the weight bearing capacity of that ankle because it's a stable fracture and a syndesmotic sprain. You can move around. Now, can I jump with these people on there? Of course not. They each weigh probably about 140 pounds, 150 pounds, but you can see that I can pick them up and move them around. Okay. All right. And here I am showing puffiness of the ankle from one side, normal ankle on the other side. And I'm getting back to the morning I want to play badminton. I'm doing cutting drills to make sure that my ankle is okay. A couple of key things here to keep in mind. I am running on a soft surface and I am moving from side to side where you can see a lot of transitions of the feet. I know I got to work on my footwork. It's not the best. I'm taking lessons right now to get better at it. But regardless, you can see I'm taking weight representing real world activities that I would be doing with this injury. And we progress to day 7. And what am I doing? You can watch these movements here. You can see them in more fluid video on our Instagram. We'll load a longer treatment protocol that we went through with this so everybody can see everything I did with it. But you can see I can do scissor kicks and switch and move where I can put full body weight from jump. That was probably about 3 times body weight with that little movement right there, full dorsiflexion, and I'm still able to do those actions. And this is what it's really all about, is getting back that functional capacity. So if we look at the key things that I did to get these results as quickly as I did at the age that I am, number 1 was early mobilization. When I was in the hospital, the doctor said, we're probably going to put you into a boot and we're going to leave you minimal movement, probably take 6 to 8 weeks for this to heal. I think that we can do better. The ways that we do better are that early movement, good foundational nutrition support. I also did lots of massage therapy and instrument assisted techniques. I've got some video that we'll put in the longer program that shows one of the doctors at the seminar doing some instrument assisted techniques. Even though I have significant pitting edema, you can still do it. And I also had good biopsychosocial support, and I integrated evidence-informed best practices to make this happen. You can do this for your multi-million-dollar athletes and your multi-million-dollar patients, but every human being is that person, a multi-million-dollar athlete or patient. So I think we can do better. You can And I hope that all of you have learned something from this video. It'll be fantastic. Like I said, we'll put a longer one up there. Massage therapy in acute injuries does and can work if you're not scared and working within the patient tolerances. Early exercise rehab. I did not do any banding exercises here. I did exercises that represented activities of daily living for better outcomes. Stop wasting your time and other people's time and start getting better results with these foundational, multidisciplinary, evidence-informed best practices, and you're going to see better outcomes that will result in much better patient, what am I going to say here? Retention, enjoyment, and quality of life, all of it. So I hope that you found this useful, and I hope to see you in a future book. All this information, of course, is discussed in our orthopedic assessment, muscle manual, our orthopedic conditions manual as well, and or any of the other 20 plus books that I've written. It's so foundational. I put this evidence-based practice stuff in every one of our books from now on. And I might see you in a CE seminar or some kind of continuing education anywhere around the world. Thank you very much for your time, and we will see you in the future. Bye for now. Mm-mm-mm-mm.